heart, then all of a sudden you start to see things on them that is attractive. And you're like, wait a minute, this person is cute or whatever. After you get to learn their essence. So how you look and how people perceive you in the world is very much affected by the inside of you, more, I think, even more than the outside, because the outside, it'll grab people's attention at first, but if there's nothing inside of you that's good or that's projecting good, then no one will care about the outside, which is why you see all these beautiful women, physically beautiful women on Instagram and Facebook talking about ain't no good men out here, you gonna miss me when I'm gone, all of this other stuff, women whining about not being able to keep a guy. But those are the main girls with the most perfect bodies and the prettiest faces, and they don't have a man because the inside is messed up. That's who you see fussing about men not treating them right the most. Why do some people have vertical incisions from a tummy tuck? Those people have excess skin in this direction also. Not just this direction. So the horizontal incision at the bottom is from excess in this direction. When we have to add this incision, it's because you have excess in this direction. So usually that's people who've lost massive amounts of weight who have that. Hi, Evelyn from Las Vegas. Lori, the excessive back fat, and loose skin after weight loss, if it's a lot, it has to be excised. So you end up with an incision on your back. Okay, let me go back and see. We should use our surgery as a tool we use to better our overall life. It shouldn't determine our worth. Absolutely. And when I do my branding and marketing and stuff, the woman that I'm not judging anybody at any age that gets plastic surgery, because I'm not against plastic surgery in younger people. Younger meaning over 18, younger people. Well, even that's not even true, because I've done things like I've done a breast reduction on a girl who was 16 before. Her breasts were insanely huge and it was making her miserable. And so, I've done surgery on children, like the pinning their ears back and the breast reduction and, stuff like that. And then obviously for reconstruction, we do it on children. So it's not even really an age thing, but it's like almost an epidemic now of really young girls changing perfectly good bodies to a body that's completely different and not their own. And I don't really like plastic surgery that makes you look like somebody else, even when it's your body looking like somebody else. Like, I feel like it should help you be a better version of your body. Like, all of these people walking around with the exact same frame is strange to me. Like, I don't particularly like that. So when I do work, I try to just make the person's, what they have going on, look like a better version of themselves. I honestly think I was too big for a tummy tuck, but with just the paniculectomy, I wouldn't have looked normal. I'm sick of not looking normal. It was a hard decision. I do have to go back in for him to address something. So I completely understand what you're saying. I'm dealing with infection. Open wounds is not easy. Please educate yourself, ladies. The bigger a person is, the more likely they are to have infections and open wounds. I don't know if you got liposuction at the same time. I'm not really sure what happened. But the larger a person is, the higher the risk for complications are. Oh, the machine. Oh, I got a good before and after picture that I'm going to probably put up tomorrow for the sculpture machine that I have. Oh, wait a minute. It's done in spa and it's ultrasonic something. Tia, I'm not sure about that one. Those ones that are done in spas I can't speak on those. What do you that about surgeons in the DR? I have a whole video about that you should probably go back and check. But I don't, it's not a certain surgeon or a certain place no, it's not certain places that I think are bad, But what I can say about the Dominican Republic specifically is that they have infections that have bacteria that are resistant to our antibiotics, and women do come back from the Dominican Republic with these infections, and they're debilitated for months and months and months on end trying to clear the infections and being in and out of the hospital, in and out of surgery, trying to drain abscesses and all that kind of stuff. And that infection comes from the DR. I think that there are good surgeons everywhere and bad surgeons everywhere, and the DR is no exception to that. And I think that you shouldn't go to a place in the Dominican Republic, the United States, Australia, France, anywhere else. You shouldn't go to a place that has when I say a place, I mean a specific plastic surgery office or a specific surgeon that has a pattern of death and disfigurement. That's what I have to say about that. For boobs and 360 lipo with Vaser, I'm 130 pounds and 29% fat. Someone told me today not to do everything at once because of the anesthesia. Now I'm scared. Any advice? Yeah. So that's what I was just saying. I just told you about what I think about the DR from a safety standpoint. So, be careful. Once you have the issues, it's hard to get rid of them. And you're going to have a hard time finding somebody to help you in the United States when you do have those issues. My consultation fee is $150. Yes, I like to do lipo first, then the tummy tuck. If a person needs both, I won't do liposuction in the central abdomen at the same time as the tummy tuck, because it's riskier from a open wound standpoint. It makes the wounds open up, it makes skin die. Not all the time, but it's a high enough complication rate that makes me say I'll just break it up in 2 surgeries. And so if a person needs both, I tend to do the liposuction first. Some people have the upper belly bulge after tummy tuck because they need liposuction. And so it's not safe to do, in my opinion, it's not safe. It's too risky to do it at the 2 at the same time. So for most, I do the lipo first. If a person is not too thick, I might do the tummy tuck first, and I'm not worried about their skin shrinking down afterwards, and then do the lipo later. But I don't do the 2 at the same time. I will not do liposuction of the central abdomen and the tummy tuck at the same time. Meme Quinn, so specific questions like that. If I have a headache, what can I take? Like, you need to talk to your doctor about that. This is not I'm not your doctor, and so I can't be telling you what to take when I don't know your medical history or what's going on. I tell my patients that gets a tummy tuck from me that the recovery is 10 to 14 days. There are doctors that give a signature look, like people will know who you went to because of the look you have, right? And I think that that's crazy. I don't like that. Make everybody look the same thing. And those doctors' wives don't look nothing like that. Just, y'all should pay attention to that kind of stuff. So you got this man who has these women rolling in there doing 5 and 6 a day and rolling them out and making these bodies that look exactly the same, and their wives don't look nothing like that. They don't marry that frame, but they're taking your money to make you look like everybody else. Like, it's just no good. Do you have time to explain a reverse tummy tuck? That's the incision up at the top to help address excess skin at the top. I don't really like that operation very much. It's a great idea in theory, but in truth, when that incision starts pulling down, it's a problem. I don't love that. I don't love that operation. Vic Brazil. Yeah, I don't agree with that. Obviously, I'm a plastic surgeon. I'm not saying you should never go under the knife. It's easy. That's kind of that's a judgmental statement. And I just think people need to be of a healthy mind and the right intentions when they do it. And it helps the value of people's lives in a huge way in a lot of situations. And no one says anything to people when they get their crooked teeth fixed or dye their gray hair, or if, stuff like, nobody says anything. So I don't really think it's fair to judge a person because their belly is all stretched out from bearing your children and they want to feel sexy again. Like, it's just not, so I totally don't agree with that statement. And a part of me feels like some people will take the complete opposite stance, like, you know, and almost neglect their physical, which I don't agree with that either, because I think a person that's really confident and strong in who they are also care about their inside and their outside. Now, I don't think your outside is more important than your inside by any means, but when you neglect the outside, that says a lot about the person too, in my opinion. So I don't really agree with that statement, Vic Brazil, but we all have our opinions and we're all entitled to them. I saw an article recently that said the older patients more often than not will come in asking to look like a younger version of themselves. Yes. Or with photos of themselves at a younger age. Yes. Then the younger patients, teens and 20s, tend to come in with photos of famous people asking to look like them. It's also went into some other rather insane statistics about how the number of plastic surgery patients ages 13 to 21 has increased dramatically in recent years. It's absolutely true, Susan. So that's my whole preserve your pretty thing. People will come in after they let stuff fall apart and be like trying to get back to their more youthful self. And if you just take care of it in the first place, you kind of stay there. So I'm 40 and I don't look 40 because I take care of my face. I take care of my skin and I haven't had any surgery on my face. I don't have any Botox or fillers in my face. I take care of my skin very, very aggressively so that I don't have to show up to somebody asking them to help me look like Myla when she was 30. You know, I try to really take care of my face so that it, you know, stays as youthful as possible for as long as possible. So that's true. Many older women come in striving to just get back to feel like themselves again. They'll say, you know, I saw a picture of myself and I was like, oh my God, is that what I look like? I want how I look to match how I feel. You know, I want to look like myself again. I feel like I don't look like myself. And I'm always uncomfortable when a person comes in and asks me to help them look like something somebody else has. Like, I don't like that at all. It makes me uncomfortable. You shouldn't be losing so much blood that you need a blood saver. And I don't know how that will work because the blood saver machine, you like are sucking up, you can use that for like, I'm not sure how you would use a blood saver machine with liposuction. I haven't seen that or heard about that being done because the fat is mixed in with it.